We are live. We're going. Hello, everybody. This is Dr. Justin.
Dr. Shannon.
And we are here on another Healthy Hump Day. And today we are going to talk about the difference between drugs and medications versus the natural approach to taking care of your depression.
Depression and anxiety and seasonal affective disorder, just mood disorders in general.
Sure. And again, we've talked about, on Monday about the seasonal affective disorder and how it changes. Today it's a sunny day, but yesterday it wasn't. It was dark, it was gloomy, and when those things come and the seasons change, we get depressed, and that stuff happens. And it's diagnosed sometimes as just regular depression, and they just put you on the drugs.
Sure, yeah. Even if it's seasonal, sometimes they'll put you on the drugs and those types of things. So what I really want to go over today is, one, what do those medications do? What are the effects of them? Are they safe? Are they dangerous? And then also, what other things you should be looking for that might be causing your mood issues? And most importantly, what things you can do to start fixing it without the need of medication. So I know this is also a hot topic, and especially if you've used, I want to start by saying this, if you've used any type of mood stabilizers or antidepressants in the past, or maybe you're currently on them, it's not necessarily that we're against those. We just know, we've done the research, that they are damaging to your body, that they have some adverse effects, and there's so many really great natural things that you can do to help balance that really never has to be your answer, but you've got to know the right things to do. So I totally understand. When you're really down, you have high anxiety, you have bad depression, you just want to feel normal. I completely get why people go on the medications, but that's why we want to teach you some better things that you can do to not have to be dependent on those.
Yeah, stop looking for the quick fix, and because that quick fix is always going to have long-term other issues and side effects, and that's even really how these drugs kind of came to happen. Is back in I think it was around the 80s, 1987 is when Prozac was actually became a drug, and when they sent this off to the FDA to be approved, they failed to mention that there was a lot of side effects. They did not write them on their application.
They omitted it.
And they did a couple. And by a couple, we talk about case studies. There was 3 case studies. They did 3 case studies. The first case study was no better than a placebo, the effects and the results.
Yep.
No better than a placebo. A sugar pill was just as good for taking care of this depression problem that they were given the drug for. The second study, it was a little bit worse than one of the drugs, but it was just slightly better than a placebo. And then the third study, and I didn't get to read the whole study, but it was like 11 patients better than a placebo.
Yeah. And
yet then the drug gets approved in 1987. All of a sudden, 10 years later, the lawsuits come out.
Yeah, huge.
If you've taken, you've seen those commercials that are always on TV. If you've had this drug, if you've had this surgery,
you might be due a settlement. Or
you should probably call the office of James Sokolov or something. I feel like he's always the one. I don't know. But they put these drugs out there, and they don't even tell you the side effects, except now they do. And the commercial is 30 seconds long of side effects, yet we still, because it can make us go from this to this, we're going to take the drug and we're going to try it.
Yeah. That's the scariest thing about these medications, is you are altering your brain chemicals. Yep. And here's the first thing I look at, is you go into a doctor with depression or anxiety, they ask you some questions, they'll do the checklist, and if you seem to fit that category, they're going to put you on a medication. They don't test your chemical imbalance. They don't look at your neurotransmitters. They don't even know if you're on a serotonin reuptake inhibitor or a dopamine blocker or whatever one it is. They don't ever test to see if that's really your problem. And then you start messing with brain chemicals, and you wonder why people are getting all of these side effects and these adverse effects. So a really great resource, I've been watching a lot of his videos, Dr. Peter Breggin. He's a psychiatrist who has written an entire book, several of them actually, does tons of videos, because he's exposing the secrets of psychiatry. And one of the books I really like of his is called The Psychotropic Drug Withdrawal, and it teaches you what those do to your brain, how to come off them safely, because this is not something you just cold turkey and try and do on your own. There's really some ways that you need to work off of these, but a lot of the things that he talks about is how flawed the system is that uses these psychotropic medications, because they don't really show to actually help that much, and they cause more damage than they're really doing. So let's look at the mechanism of some of these things. So what the medications are designed to do is have an effect on your frontal lobe. Your frontal lobe is the area of your brain that gives you emotion. It's the area of your brain that creates interaction. It's the area of your brain that makes you have desires to do things, right? So if that is either really low and you have depression, or overactive and you have anxiety, they're going to choose a medication to make an effect on that frontal lobe, right? But unfortunately, what the medications do is they don't actually balance whatever is going on. In essence, they just dampen brain function. So physically, you're just slowing the function of your brain. So a lot of times, and one of the things that Dr. Reagan always says is, you have these people who start these medications and they come back, and the questions that the doctor asks them are designed to get them a favorable response. So it's, is your mood a little bit better? Do you feel less depressed? Have you had no suicidal thoughts? But they never ask them, how's your quality of life? Do you have joy? Are you enjoying your activities? Do you enjoy being around your family? They don't ask quality of life questions. They just want to make sure they helped you get out of that slump, which is great. But people are relying on these medications to bring them this joy when that's also not their job. They dampen brain function. So probably one of the biggest things that is dangerous about these medications is that in slowing and dampening brain function, you're also altering the way that your body communicates, your brain communicates to the rest of your body. And they've done a lot of different research studies actually showing that people who have been on these medications for more than 3 years, that's not very long, they can actually see shrinking of the brain tissue under the microscope because you're slowing brain function. This is why it gets so hard to come off the medications. This is why you always kind of hit that status quo, but you never have the highs anymore, or the lows, but you're just kind of dampened, right? You're just kind of like a slowed down version of yourself, which isn't a way that we want you to live when there's other ways that you can get your joy and your health back. So those are just a few. There's hundreds of things we could talk about it, but it will absolutely damage your brain to be on them long term. It will absolutely alter your brain chemicals, which you don't even know. They tell you have a chemical imbalance off of symptoms, but they never tested for it. And there's a ton of other side effects that happen when you're on those medications.
Yeah, and a lot of people are getting put on these drugs and these medications without even having depression and anxiety.
Right.
They don't even have the symptoms, but because some of those boxes were checked, you're a good candidate.
Yep.
Or because you have fibromyalgia, you hurt all over the place, and your blood work is normal, your body is normal. There's nothing wrong that I can find with you. So it's all in what?
In your head.
It's all in your head. And they tell you that. And if they told me that, I would be so angry. Don't tell me it's in my head. Something is going on with me. And that's the difference between us and wellness way doctors versus like just the medical model or even functional medicine type doctors. It's just, they just look for treating symptoms and covering up things. How can I shut you up? How can I just make you feel better so you can go on your way and just keep coming back for your refills? That's the sad reality, but that is what happens.
Yep. And also with these medications, a lot of people will say, well, I'm just going to try and go on them short term and maybe wean myself off. And some people have success with that. But again, the research shows, especially things like Xanax or a couple of the more powerful things, you can be lifelong addicted after a 6-month use of these, 6-week use of these medications can give you long-term addictions to them. So being very careful when you make those choices to come on and off these medications is huge. And don't feel bullied into it either. You have choices, you have options. It's just going to be up to you to figure out what those are.
It's also amazing today how many children are on these depression medications. Mm-hmm. These kids that are 5 years old are just so depressed that they have to be medicated.
Dampening brain function in the time of their life that their brain should be developing, and then we wonder why we have all these learning disorders and all these mood disorders and all these other things going on. You're physically altering the growth of a brain of a child because they can't sit still in class long enough when you jacked them up on sugar for breakfast. And
it had nothing to do with that.
Oh, okay.
It had nothing to do that I ate the healthy fast food. You know what that one is, right?
Chick-fil-A.
Chick-fil-A. I had Chick-fil-A. It was all good. We go there every day, and I'm like, oh my gosh, there's why you get your headaches. There's why you have your problems.
But I get the grilled chicken.
It's grilled. Well, I take the bun. All right. No, you're eating fast food still. Don't try to just tell yourself and believe it, because obviously you do. It's not good for you. It's not real food. We have to eat real food and stop eating all these grains and all these sugars if you want you to be healthy, if you want your kids to be healthy.
Yep. So that's the first transition over. You want the simplest, easiest and free way to start getting your mood stabilized, stop jacking yourself up on sugar and things that are known stimulants to your brain, like aspartame, artificial colors, dyes, and all of those things that are in so many foods that you're probably consuming on a daily basis. Those irritate your neurons, those cause your brain to like literally be on fire, and a lot of those symptoms. So that's change number one. Cut it out.
We should have had the whiteboard. There's white birds, I assume. But we could have our white bird, and we could write on it and say, stop jacking sugar. So there's number one for you.
Number one, just stop eating sugar. Free, easy advice, right?
Yeah, number two, I mean, you really got to get tested too, and we'll talk about this too, but like getting tested properly and find there's always a reason and a cause to any symptom. Your body will never do anything wrong at the wrong time. And so if you're having issues, if you're having symptoms, if you're having depression, if you're having, let's figure out why rather than just trying to cover up the symptom. Again, short-term wise, you tried to do it. We're not judging you, maybe, right? But you got to find a better solution to it. Yep. And that's the point of getting your body and your physiology tested.
Yes.
I get my physical every year.
Nope. But they test just very basic. Your cholesterol and your glucose has very little to do about that. But on that same point, though, when you get on these medications, there's another research study that shows that if you've been on it longer than those 3 years, that your life expectancy can be 20 years, 25. I read 20 years shorter than someone who hasn't been on these medications. And the reasons are those medications alter your brain chemicals so much that it forces your body to gain weight. You get obese, you develop diabetes. There's a huge correlation between antipsychotropic medications and increase in cholesterol and inflammation. And these people are dying 20 years earlier than someone who doesn't go on those medications. So someone who tells you it's perfectly safe, get the literature, ask them flat out, show me one study that says this is perfectly safe and that I'm not going to die 20 years sooner from being on these medications. So listen, if you're on these medications, I am so sorry that you got stuck in that spot, but now let's figure out a way that you don't have to stay there and then rebuild some of the damage that might have done. So change number one, quit the sugar. Number two, get tested. If you come in with any type of mood disorder, I can almost guarantee you we're going to start looking at your gut, because your gut is responsible for making those neurotransmitters. We're actually going to look, is your body physically, chemically imbalanced, or are there some other things going on? So checking things like an inflammatory panel, physically checking neurotransmitters, looking at adrenals, looking at the gut. Those are all places in your body that create depression and anxiety. And if you don't look there, then you will be stuck on a medication for life. But if you start fixing that cause,
it's amazing. We have these drug freedom trash cans in our office, and there's a ton of depression and anxiety medications. I mean, there's cholesterol, blood pressure, diabetes. I mean, there's all kinds of different things in there. People have thrown their cigarettes in there because they're done and they've quit smoking and whatnot. But it's just, if what you're doing is not working, you shouldn't keep doing more of it. I believe that's the definition of insanity.
Yes.
Like, you got to do something different if what you're doing is not working. If you want something different, and if you're watching, if you're hearing this, if you shared this with a friend that you know that they needs to hear this, they want something different. They just don't know what.
Sure.
And that's the problem. You think that the white coats are your answer, and all they really want to do is give you more drugs.
Yeah.
And cover up symptoms. They're not going to do anything to truly fix you and help you get the results that you want, which is really what we try to do and strive for our patients.
Absolutely, and it starts with testing. I really think that number one rule before you get on any medication, there should be required proper testing for whatever they're trying to medicate you for. So if it's a chemical imbalance, you better ask for them to show you proof that your chemicals are in balance before you try and mess with them, because ultimately what you're doing is probably creating more imbalance than you are helping. So cut out the sugar, get tested, and remember, you can get tested anywhere around the world. We can send stool samples, we can send urinalysis, we can get it to anybody, anywhere. So the excuse of my doctor won't test me is no longer a valid excuse. We have a network of over 50 Wellness Way doctors all across the country who can help patients all across the world. You just need to take it upon yourself to decide you're going to do something different and reach out and get your testing done. So that's huge.
But yes, your doctor won't test you this way. They just don't do it.
No, they won't.
And insurance won't cover it. And that's why they don't do it. Insurance doesn't cover those tests. So it will cover some. Right, we can get into that later. And then Friday, what we're going to be talking about, we'll just bring it up right now, is really some of the things that we can be taking right now to help with this depression, to help with your anxieties. Rather than taking drugs, rather than taking the medications, what can we be taking? Vitamin G. Vitamin G is the best one you can take.
Vitamin G?
Yeah, vitamin G. I said that one right. I said it. But no one knows what that is?
No.
She doesn't even know. See, I stumped her. That's pretty
I
funny.
don't know what that is. Maybe he made it up. I don't
Anybody know what vitamin G is?
Answer below, I guess. That's a good one. We'll have a prize for you on Friday.
Answer below, or we'll tell you on Friday what vitamin G is and why it is the cheapest and most effective supplement for taking care of depression.
Oh, I'm
Stay
going to be
tuned.
watching. Yeah, I'll watch that one for sure. So what I
Any
want to
tips?
leave you with today, so we're going to talk about the herbs and the supplements that we like on Friday. But I want to give you some lifestyle stuff that you can do right now to start helping with coming into this season, what you can start doing. So some of my favorite tools, and again, it's not a quick fix, it's not a medication, it's something you're going to have to practice every single day. Something like EFT, Emotional Freedom Technique.
Yes.
I love that. If you don't have
Powerful.
access to a good, psychologist or psychiatrist or counselor that you feel comfortable with, there are so many things you can do at home. So EFT is a technique that uses different areas of your body that you tap on as you say certain things to release negative emotion and anxiety and depression and stress. It works for chronic pain. There are tons of videos on YouTube that you can learn how to do it and follow. One of my favorite websites is thetappingsolution.com. They have a huge library of videos you can follow, some for anxiety, some for depression, some for weight loss, mood, whatever you might be suffering with. It is a really great tool to begin to unwind those neural pathways, to form new pathways in your brain so you don't have the same connections with the depression or the emotion, and you can do it for free at home every single day. So again, there's no excuse of the natural way is too expensive. Stop eating sugar, start doing EFT. But the difference with that versus a medication is you have to practice the emotional freedom technique every day, because the more you do it, the more your brain learns what you're doing. So the first few times you go through it, you might not feel a whole lot. You might even feel a little bit silly. Most people tell me that because you're tapping on your head, you're tapping on your face, you're saying things
So you're
like, I
tapping and rubbing
release.
at the same time,
Yeah,
is
can
that-
you tap and rub at the same time? I've had people be like, I'm going to come back here on Monday, there's going to be bruises all over my face because I'm going to tap so much this weekend. But the more you get to do it, and you'll find areas in your body that are powerful. Now for me, I've done it so often that if I start to get anxious, if I start to get kind of stressed out, and if you know me, you probably see me do this, I just tap right here. That's my most powerful spot on my body. I've learned that over the years, and I can feel a physiological release. I calm down almost immediately by doing that, but I had to train my body to know what to do. So don't give up if you don't feel something 1 or 2 or 3 times. Keep doing it, and it's kind of like Kegels. I say do it everywhere. Do it when you're on the toilet, do it at a red light, do it before you go to bed, do it as many times as
I'm
you can
Kegels
think
right now,
of.
so.
Even before you're anxious or depressed, because if you can train your body to do it first, then when you really need it, it's going to work a lot better. So EFT is a huge, free, easy resource. You look on YouTube, go to thetappingsolution.com, or there are tons of amazing guided meditation apps that you can get on your phone, things that you can look online, anything that you can consciously start getting your brain to unwind, letting go of negative emotions, letting go of some of the pathways you formed from experiences in the past, from rejection or from other things that have created that depression before. Start using those tools now before you really get into your season of sadness, and they're going to be a whole lot more powerful. So I really go today, find one of them, try either EFT or some guided meditation, and really commit to it. Commit to yourself that you're going to do it every single day from now until March, and tell me that doesn't make this season better for you.
Yeah, because you can't tell me that anybody out there is not stressed. And stress causes a lot of these problems, and these things are stress relievers that she's talking about. I mean, I've seen people that have migraine headaches that have adjusted and done things, and they can't get, it's not going away. We've gone in the back room, and we've tapped, and literally, it's just gone.
Yeah.
And it's not that everyone happens that way, like she said, but you just keep doing it, and it's amazing. It's very powerful.
Yep.
But their trigger was stress.
And that's so many of you, and we can't take the stress away. So I want to teach you tools that you can use when it happens, that you don't feel like you're spiraling out of control. So if you get really good at those things, I'm telling you, it makes such a big difference.
Yep.
So recap again: you're cutting out sugar, free. That's one really great suggestion.
What was it? Quit jacking up on sugar?
Quit getting jacked up on sugar, and quit jacking your kids up on sugar. You can quote that, make a meme with that, my quote. Get tested. That will not be free, but it will be worth every penny, I promise you that, and it's different for everybody. So reach out to our office or Wellness Way office, and we can walk you through exactly what testing looks like. And then start some ways to manage your stress, either EFT or doing some guided meditation, and do it every single day starting now. Don't wait until you're already depressed or anxious. Start now so that your body starts to relearn those pathways.
Yep, and then make sure you tune in on Friday. We'll have some more tips and just some vitamin supplements, and we will be revealing
Whew.
what vitamin G is and why it's so good for you. I also want to leave you with this. I was driving home yesterday on the radio. It was a funny commercial. I just thought I should tell you. And I don't even know what it was advertising for, but it was funny, and I was laughing. I was LOLing, actually. And he goes, he's trying to figure out his password, and he goes, I know, it's Doug. Okay, it's Doug 1. Doug 1 2. Doug 1 2 3. Doug 1 2 3 _ exclamation point @ sign. Right? It was just hilarious. You guys, if you have 17 different passwords because they made you change it, I thought it was very funny because we can never remember.
I just add an exclamation point every time.
Yeah,
so probably like 7 exclamation
30
points.
exclamation points. Now there's an underscore. It's like, no one's ever going to know this. So.
That's true.
Good luck stealing
That
my
is
password.
our struggle daily. All right, I hope you guys learned something today. If you struggle with depression and anxiety, remember these are some simple tips you can start doing, but you absolutely need the help of a trained professional, a medical professional to help you really take care of this. So reach out, get the help that you need, and we would love to be the ones to take care of you.
Sure.
So tune in Friday.
Make sure you like this page. Make sure you share this. Make sure you tag somebody that needs help with this.
Absolutely. Have a happy, healthy hump day.